Another day, another video of first aid by. How long do laxatives take to work? First aid by. Laxatives are commonly used to treat constipation and promote bowel movements. They work by either softening stool or stimulating bowel contractions to help move stool through the digestive system. How laxatives work. Laxatives can be classified into several categories based on their mechanism of action. Some of the most common types of laxatives include 1. Bulk-forming agents. Bulk-forming laxatives are the most commonly used type of laxative. They work by absorbing water in the intestines, which increases the bulk of the stool and stimulates the intestines to contract, helping the stool to pass. Bulk-forming laxatives generally come in the form of powder or granules which are added to food or a beverage. Because they take some time to work, they are usually taken once or twice a day. 2. Stool softeners. Stool softeners are laxatives that work by increasing the amount of water and fat in the stool. This helps to soften the stool and make it easier to pass. They are often used to treat constipation, but they can also help to prevent it. Stool softeners are generally safe to use, but they can cause some side effects such as abdominal cramps, bloating, gas and diarrhea. 3. Lubricants. Lubricants, such as laxatives, are substances that help to reduce friction between surfaces and reduce the amount of energy needed to move them. Laxatives work by increasing the amount of water that is present in the intestines. This helps to soften the stool and make it easier to pass. It also helps to stimulate the muscles of the colon, promoting regular bowel movements. Lubricants also help to protect the lining of the intestines, reducing irritation and inflammation. 4. Osmotic agents. Osmotic laxatives are a type of laxative that work by increasing the amount of fluid in the intestines to soften stool. This allows stool to pass through the intestines more easily, leading to improved bowel movements. Osmotic laxatives work by drawing water from the body into the intestines. This creates an osmotic gradient, which is a concentration gradient of fluids between two different solutions. The osmotic gradient pulls water from the body and into the intestines. 5. Stimulants. Laxatives work to help relieve constipation and promote regular bowel movements. They typically come in pill or liquid form and act as stimulants, increasing the motility of the colon. This increases the pressure of the wall of the colon, causing it to contract and thus helping to move the stool along. Some laxatives are also known as stool softeners, which help to make the stool softer and easier to pass. Factors that affect laxative speed and effectiveness. The onset time for laxatives can vary depending on several factors, including 1. Type of laxative. The speed and effectiveness of a laxative depend on a variety of factors. For example, the type of laxative used, the dose taken, the diet consumed, and the individual's overall health can all have an effect. Different types of laxatives work in different ways, and some may work faster than others. The dose taken can also affect the speed and effectiveness of a laxative. Taking a laxative in higher doses can speed up its action, but it can also increase the risk of adverse side effects. 2. Dosage. The speed and effectiveness of laxatives depend on a number of factors, such as the type of laxative, the dosage, and the individual taking the laxative. Generally, the higher the dosage, the faster and more effective the laxative will be. However, it is important to note that taking too high of a dose can lead to dangerous side effects. Additionally, the individual's health, the underlying cause of their constipation, and the type of laxative they are taking can also affect the speed and effectiveness of the laxative. 3. Timing. Timing is an important factor that affects the speed and effectiveness of laxatives. Depending on the type of laxative, different factors can influence how quickly it takes effect. For example, if you take a stimulant laxative, such as castor oil, it will generally take effect within 6 to 8 hours. If you take an osmotic laxative, such as magnesium citrate, it can take up to 4 hours to take effect. 4. Individual factors. Individual factors can play a large role in the speed and effectiveness of laxatives. Age, gender, and overall health can all influence how quickly a laxative will work. For example, older individuals may have slower digestive systems and require a stronger laxative to achieve the desired effect. Additionally, women may find that their bodies respond differently to laxatives than men do, and may need to adjust the dosage or type of laxative accordingly. How long does it take for laxatives to work? The onset time for laxatives can range from a few hours to several days, depending on the type of laxative and other factors. Here are some general guidelines for how long it takes different types of laxatives to work. 1. Bulk forming agents. These laxatives may take 12 to 72 hours to work, depending on the dose and individual factors. 2. Stool softeners. These laxatives may take 12 to 72 hours to work, depending on the dose and individual factors. 3. Lubricants. These laxatives may take 6 to 8 hours to work. 4. Osmotic agents. These laxatives may take 1 to 3 days to work, depending on the dose and individual factors. 5. Stimulants. These laxatives may take 6 to 12 hours to work. What to expect when taking laxatives? While laxatives can help relieve constipation and promote bowel movements, they can also cause some side effects. Some common side effects of laxatives include 1. Cramping. 2. Diarrhea. 3. Nausea. 4. Abdominal discomfort. 5. Dehydration. In rare cases, laxative use can lead to more serious complications, such as electrolyte imbalances or bowel obstruction. To minimize the risk of these complications, it's important to follow the recommended dosages and use laxatives only as directed. When to seek medical attention. If you experience severe or persistent abdominal pain, blood in your stool, or other serious symptoms while taking laxatives, it's important to seek medical attention. These symptoms may indicate a more serious underlying condition, such as an intestinal blockage or inflammatory bowel disease. Alternatives to laxatives. While laxatives can be effective for treating constipation, there are also several lifestyle changes and natural remedies that can help promote better digestive health. Thanks for watching.